Hello, and a very warm welcome back to my channel. Before we begin, please remember that the information in this video is for educational purposes only and should not be taken as a substitute for professional medical advice. Always consult with your doctor or a qualified health provider with any questions you may have regarding a medical condition. Last week, a dear patient of mine, John, a 72-year-old man with a real sparkle in his eye, shared something with me. He said, "Dr. Rose, I used to love taking spontaneous road trips with my wife. We'd just hop in the car on a weekend and drive to a small town with no plan at all. But now whenever I think about going anywhere longer than 30 minutes, I start to feel anxious. The worry isn't about the car breaking down or getting lost. It's about not being able to find a restroom in time." John's story really stuck with me. That sense of freedom, the joy of discovery, and our very confidence can sometimes be held back by such a private worry. Today I want to talk about more than just that problem. I want to share a simple habit, a small shift in our daily lives that has the incredible power to help give us back the energy, the stamina, and the drive that many of us feel has faded after 65. I'm Dr. Rose Khavari, a specialist in urology. For over 15 years, I've had the privilege of listening to thousands of stories from people just like John, and just like you who are watching right now. Stories about waking up 2, 3, or even 4 times a night. Stories about turning down a coffee date with friends or a trip to see the grandkids all because of a worry about their bladder. And I am here to tell you something very important. This does not have to be a life sentence. Our bodies at 60, 70, or 80 are still remarkable and wonderfully adaptable. Today we're going to explore the simple habit that has changed the lives of so many of my patients and even my own. We'll dive deep into not just what to do, but why it works. So please get comfortable and let's talk. Before I reveal what that habit is, let's talk for a moment about the connection between our energy levels and our bladder health. Many people don't realize how closely and how scientifically the two are linked. It's far more than just feeling a little tired. Let's go a little deeper. Our sleep isn't one long uniform block of rest. It's a beautifully designed cycle with different stages, most importantly deep sleep and REM sleep. During deep sleep, our body does most of its physical repair work, mending tissues, building bone and muscle, and strengthening our immune system. During REM sleep, our brain is hard at work consolidating memories and processing emotions. This is the work that helps us wake up feeling not just rested, but also sharp and emotionally balanced. Now imagine this. You're settling into that crucial deep sleep stage, the time when your body is finally getting the restoration it desperately needs. Suddenly an alarm clock from your bladder goes off. It's an urgent signal that you cannot ignore. So you get up, make your way to the bathroom, and then come back to bed. Your sleep has been broken. By the time you fall asleep again, you have to restart the whole cycle. If this happens once, twice, or even more times a night, you can be deprived of those most restorative sleep stages. Your body and brain may not get to complete their essential nightly maintenance. What's the result? You wake up in the morning feeling tired, groggy, and foggy-headed, as if you haven't slept at all. This isn't just a feeling, it's a physiological reality. This daytime fatigue makes you far less likely to be active, to take that walk, or to work in the garden. And when we move less, our circulation suffers, our muscles weaken, and our overall health begins a slow decline. It becomes a deeply frustrating cycle. Poor sleep leads to low energy, which leads to less activity, which in turn can lead to even poorer sleep. But there's another layer to this. There's a powerful hormonal connection at play. Our bodies naturally produce a wonderful hormone called ADH, or antidiuretic hormone. You can think of it as a signal to your kidneys to slow down urine production while you sleep. As we age, our bodies sometimes produce less of this hormone at night, meaning our kidneys keep working at a daytime pace. This, combined with a bladder that may not hold as much as it used to, creates the perfect storm for nighttime awakenings. And then there's the mental and emotional side, which is just as draining. The constant low-grade anxiety of, "I might have to go right now," creates an undercurrent of stress. It's the mental checklist you run through before leaving the house. Where are the restrooms? Will I get an aisle seat on the bus? Should I drink this glass of water? This constant vigilance is exhausting. It can flood your system with the stress hormone cortisol, which ironically can also interfere with sleep. Slowly, almost without us noticing, our world can begin to shrink. We turn down invitations. We avoid long car rides. We stick to familiar places. We confine ourselves to the safety of our own home. But that safety often comes at the profound cost of joy, spontaneity, and human connection. So, you see, the issue isn't just about inconvenient bathroom trips. It's about your quality of life, your physical vitality, your mental peace, and the energy you have to enjoy each and every precious day. There is a sentence I hear almost every day in my practice, often said with a sigh of resignation, "Oh, well, I'm getting older. This is just normal, doctor." I would like for us to pause right here and really examine that statement together. First, I want to be clear, certain changes are a natural part of the aging process. It's true. The muscle tone throughout our body, including the bladder and the supporting pelvic floor muscles, may decrease. Our hormone production, like the ADH I just mentioned, does shift. Our body's ability to concentrate urine changes. I will never deny these biological realities. However, and this is the most important point I want to make today, there is a grand canyon of difference between acknowledging a change and accepting a challenging condition. Accepting discomfort, fatigue, embarrassment, and a loss of control as inevitable is the single biggest misunderstanding that holds people back from feeling better. Let's use an analogy we're all familiar with. If your eyesight started getting blurry, you wouldn't just stop reading or driving at night and say, "Oh, well, this is just normal." No, you'd go get an eye exam and a new pair of glasses. If your blood pressure was high, you wouldn't just accept the risk of heart disease. You would talk to your doctor, watch your salt intake, take a walk, and manage it with medication if needed. You would take action. Frequent urination or waking up multiple times a night is not a non-negotiable symptom of your age. It is a manageable condition. It's a sign that a system in your body is out of balance and needs some gentle supportive attention. To say it's just normal is a form of giving up. It's a passive stance that reduces your power to improve your own well-being. By choosing to see it as a manageable condition, you shift from being a passive passenger on the journey of aging to being the proactive, capable driver of your own health. You empower yourself to seek solutions, make small changes, and reclaim the quality of life you deserve. And the good news, the truly wonderful news, is that the solution often doesn't require a trip to the pharmacy for complicated medications or scheduling invasive procedures. The solution is frequently found in relearning simple fundamental habits that work in harmony with your body, not against it. And this is the habit I want to share with you. I call it the rhythm of hydration and release. It might sound a little poetic, but it's a very practical and science-based approach that involves two simple, powerful parts that work together, and I encourage you to think of them as a team. Part 1, mindful hydration. When people experience bladder issues, their first logical reaction is often, "I should drink less water." On the surface, it makes sense, but it's a very common mistake that can actually make things worse. When you don't drink enough, your urine becomes highly concentrated, it's darker in color, and has a stronger odor. This concentrated urine is a known irritant to the delicate lining of the bladder. This irritation can send more frequent and more urgent signals to your brain, making you feel the urge to go even more often. It also significantly increases your risk for painful urinary tract infections. So the key is not to drink less, but to drink smarter. Let's break it down. Start your day with a big glass of water. Think of this as your morning wake-up call for your entire body. After a long night, you are naturally dehydrated. A glass or two of water first thing helps to rehydrate your cells, kickstarts your metabolism, and can give you a surprising boost of energy. Front-load your fluids. This is the core of the strategy. Instead of drinking sporadically or saving your thirst for the evening, be intentional. Focus on sipping water steadily from the morning until about 4 or 5 p.m. Keep a water bottle handy. Think of it as a gentle, steady stream throughout the most active part of your day when your body needs it most. Taper off in the evening. This is crucial for restful nights. About 2 to 3 hours before you plan to go to sleep, start to significantly reduce your fluid intake. This doesn't mean you can't have anything. If your mouth is dry or you need to take medication, small sips are perfectly fine. But avoid big glasses of water, mugs of tea, or large bowls of soup. This simple change gives your kidneys and bladder ample time to process the day's fluids, and for you to empty your bladder fully before you get into bed. Become a detective of bladder irritants. This part can be empowering. Certain foods and drinks are known for irritating the bladder. While you don't have to eliminate them, all becoming aware of them is key. The usual suspects are caffeine, alcohol, carbonated drinks, acidic foods like tomatoes and citrus fruits, spicy foods, and artificial sweeteners. I suggest keeping a simple notepad for 3 to 4 days. Jot down what you eat and drink, and when you feel a particularly strong, sudden urge. You might discover a personal pattern like, every time I have that afternoon diet soda, my evening is much more difficult. Knowledge is power. Part 2, bladder training. This is the real game changer, where you actively reclaim control. Your bladder is a hollow muscle, and just like any other muscle, we can train it. When we get into the habit of going to the bathroom at the very first slightest sensation, we can accidentally train our bladder to be overly sensitive. Bladder training is the gentle, patient process of reversing that training. It's about reteaching your bladder that it can in fact hold more, and that you are the one who decides when it's time to go. Step 1. Start with a diary. Before you change anything, just observe. For 2 or 3 days, use a notepad to write down the time you use the restroom. You're not judging yourself, you're just collecting data. You'll quickly see your pattern. This is your baseline. Step 2. Set a schedule. Based on your diary, create a purposeful bathroom schedule. If your diary shows you go every hour, your new goal is to go every 1 hour and 15 minutes. The key is to go at that scheduled time, whether you feel a strong urge or not. This starts to put your conscious mind, not your bladder's reflex, in charge. Step 3. Calmly ride out the urges. This is the most challenging but also the most rewarding part. An urge will inevitably strike before your scheduled time. Your old habit might be to rush. Your new response will be to be calm and strategic. Here's a technique you can use. Stop and be still, don't rush. Sit down if you can. Take slow, deep breaths. Breathe in through your nose and let your belly expand. Breathe out slowly through your mouth. This calms your entire nervous system. Do a few quick pelvic floor squeezes. Squeeze the muscles you'd use to stop the flow of urine. Squeeze and release them a few times. This sends a signal back to the bladder to relax. We'll talk more about these amazing exercises in a moment. Distract your mind. Actively think about something else for 2 to 3 minutes. Make a mental grocery list. Recite the lyrics to a favorite song. You may be astonished at how often the intense urge simply fades away or lessens significantly. Step 4. Gradually increase the time. Once you're comfortable and successful with your new time interval for a few days, it's time to stretch it again. Add another 15 minutes. Your goal is to work your way up slowly and patiently to a comfortable interval of 3 to 4 hours between bathroom trips during the day. This is a journey of patience. It is not a quick fix. There will be good days and challenging days. That is perfectly normal. But after a few weeks of consistent practice, you may begin to notice a profound difference in your sense of control and peace of mind. Now, I mentioned squeezing certain muscles to help control an urge. This brings us to a crucial partner in our journey to better bladder control the pelvic floor. This is truly the unsung hero of our core. So what is the pelvic floor? Imagine a strong, flexible hammock of muscle stretching from your pubic bone in the front to your tailbone in the back. This group of muscles supports your bladder, your bowels, and in women, the uterus. When it's strong and healthy, it acts like a supportive seal. When these muscles weaken, that seal isn't as effective, which can contribute to leaks or that feeling of urgency. For both men and women, the pelvic floor can weaken over time. The great news is that just like your bicep, these are muscles you can strengthen. The exercises to do this are famously known as Kegels, but many people do them incorrectly. So let's learn how to do them right now. First, you have to find the right muscles. This is the most important step. Let me be very clear, the following is only an identification test, not a regular exercise. It is meant to be done once to help you find the right muscles. The identification test. The next time you are urinating, try to stop or slow the flow for just a second. The muscles you use to do that. Those are your pelvic floor muscles. Again, it is very important that you do not make a habit of stopping your urine flow, as this can interfere with proper bladder function. This is only a one-time test. Another way for women. In a private, relaxed setting, imagine you are trying to lift a small pearl with your vaginal muscles. That lifting and squeezing sensation uses the correct muscles. Another way for men. In a private, relaxed setting, squeeze the muscles as if you are trying to stop from passing gas without tensing your buttocks. That internal squeeze is the correct one. Once you've found them, here is the exercise. Get comfortable. Start by lying down. It's the easiest position to learn in. The squeeze those pelvic floor muscles and hold the contraction for 3 seconds. It should feel like an internal lift. The release, relax completely for a count of 3 seconds. It's just as important to fully relax as it is to squeeze. The repetition. That's 1 rep. A good goal to work toward is 10 repetitions 3 times a day. A few very important tips. Breathe, do not hold your breath. Breathe easily. Isolate the muscles. Be careful not to tighten your stomach, your buttocks, or your thigh muscles. Be consistent. Like any exercise, it takes consistent practice over several weeks or months to build strength, but it can be so worth it. Let me bring this all together with the story of Eleanor. When she first came to me, she was feeling defeated. A passionate gardener, she had stopped going to her neighborhood club. She felt embarrassed by her constant need for the restroom. When we discussed this program, she was skeptical. I encouraged her to be patient, be consistent, and be kind to herself. She started with the water front-loading her hydration. She started bladder training at first, only managing to wait an extra 5 minutes. She practiced her Kegels every morning before getting out of bed. Some days were harder than others, but she stuck with it. 3 months later, she walked into my office with a huge smile. She told me she had spent an entire morning at the gardening club and had only needed the restroom once during a scheduled break. She said, "It's not just that I can garden again, it's that I don't think about my bladder anymore. I can just live. I feel like I got me back." Stories like Eleanor's are tangible proof that these small, consistent efforts can lead to a wonderful return of freedom and confidence. So as we wrap up our time together today, what are the key takeaways? First, and most importantly, please release yourself from the idea that bladder issues are a normal, unchangeable part of aging. They are a manageable condition, and you have the power to improve them. Second, remember the core habit, the rhythm of hydration and release. Drink your water smartly, more in the morning, less in the evening. And patiently train your bladder so that you are in the driver's seat. Third, don't forget your unsung hero, your pelvic floor. A few minutes of simple Kegel exercises each day can provide the essential support your bladder needs. This journey requires patience. It is an act of deep self-care. It's about deciding that your comfort, your confidence, and your energy are worth it. And they absolutely are. I hope today's conversation has given you a sense of hope and a practical, actionable plan you can discuss with your healthcare provider. If you found this video helpful, please consider clicking the like button and subscribing to the channel so we can continue on this journey to healthy, happy aging together. And if you know someone you care about who might benefit from this message, please feel free to share it with them. Thank you so much for your time and your trust. Until next time, stay healthy, stay active, and please take good care.